that means is that our mandated services are provided to you based on your income and your ability to pay. So if your ability to pay is very low, you could not have to pay for services, but they're not free. They're covered by one of those other pots of money, okay? Our mandated services include tuberculosis, immunizations, STD care, environmental health, and epidemiology, okay? We do provide family planning services through grant-funded care because we care about the community and we want to ensure that people have access to birth control because abortion is not a form of birth control. That is not me saying that I'm against or for. It's just not a good form of birth control. And I think we all agree with that. And also, if you don't want to have children, but you, for whatever reason, think that the rhythm method works or whatever your preference is, we want to be sure that you can do that. Because anyone that is between the ages of, 12 now, and about 45 or 50 that's having unprotected sex is planning for a baby and could also be planning for STD. So you have to protect yourself. That's the education that we provide. Those mandated services that we do even when our pots of money run low. And so then what happens is that cash pot that we have helps cover those programs to assure that we provide those mandated services. Disease control is very important with tuberculosis and STD. Unfortunately, a new report just came out, and just right here in Duval County, we are number 5 in the nation for STDs. Gonorrhea and chlamydia, I believe, don't hold me, but just a bad thing, okay? And so when you talk about statewide, you're like, yeah, nationwide, we're number 5 on the list, and that's like not a good thing. Tuberculosis care is something that that I hold near and dear to my heart. It's one of the programs that I oversee, and it is something that is not only mandated through our services, but it is also mandated through state statute. And so if you are an active case of tuberculosis and you choose not to follow the health department's plan of care, and you are not under your private physician's plan of care, we can court order you to take care, whether that be in hospital, and if you are not nice to the nurses in hospital, we can then put you in our local jail. And that is under a civil order, but it is very, very real, and unfortunately, I have a great relationship with the local judge here because we often have to court order persons in order to get them to take their medications, which is sad. But you also have to consider socioeconomics, your ability to understand. And socioeconomics absolutely affects what you may or may not believe in regards to what the health department is trying to do to protect you. And so, you guys gave me TB. Trust and believe, I still want a job, but I'm not trying to give you TB. But you will take this treatment, and if you don't, we will court order you. And I say it with a smile, and sometimes I don't. And so that's just the way it is. We no longer have a state sanatorium for tuberculosis. Sorry, I'm a little bit. Yes. And I talk in my head. So we no longer have a state sanatorium for tuberculosis. So with that, the state has, and when I say the state, I mean the Department of Health, has developed a relationship with UF Health here in Duval and Jackson Memorial down in Miami. And so those patients throughout the 67 counties that may have to be court ordered go to either one of those places. Unfortunately, the very one time that UF Health was full and we had to take a patient to Miami, I didn't go. Because I was going to take the scenic route and stay on the beach and But he was not being nice, and so he actually got escorted by JSO down to Miami. But it is very real, and it's something that we do. STD services, unfortunately, don't have the same light behind them. And so we do have disease intervention specialists, and those are called DIS. They are typically not medically trained. However, they are what you would consider an outreach team that work very closely with our nursing staff to be our eyes and ears in the field. And so while TB and STD both have DIS, the STD DIS kind of have their hands tied more than TB, because when TB has a problem and people aren't taking their meds, they tell me and we get started, and our legal counsel for Duval is short, and so she has short person syndrome, so she's a little bit of a bulldog, okay? And she would be okay with me saying that. But on the STD side, there is a lot of education. And there's a lot of meeting people where they are. Just today, I had some staff ask me to review a little card that they're going to be using, and I believe that it stated that you shouldn't use drugs, don't inject drugs, but if you do, use clean needles, and so on and so forth. And so they were like, and I was like, well, this is correct because we have to meet people where they are. And so don't do drugs, but if you do, don't share stuff. Don't share needles. Don't do a tub of water and wash off your site, and then the next person come and wash the site with that same water, and because I didn't understand why the word water was in there. And so we have to meet people where they are with our STD treatment. We will, because we have our DIS that go into the field, we will meet you where you are. If that is under the bridge, if that is at the Burger King on Beach, if that is at your house, at your mama's house, at your sister's house, at your cousin's house, at your place of work, wherever, we will meet you and provide treatment. Because you got to take it. And so that's one of the things that we are afforded on the disease control side of the house. I'll talk a little bit about family planning before I go into what we're doing with Hep A and what's going on with coronavirus, because that also is headed up by the health department. So family planning services, like I mentioned, we do provide that on a sliding fee scale. With our family planning services, we also provide women's health because we want to make sure that we don't have any babies that are stillborn. We want to make sure that mothers are getting prenatal care. And so even if you are undocumented, and this is one of the things that is different about us at the health department. We don't care what your documentation status is. We will do a sliding fee scale. We will do finances because nothing's free. But we are going to provide those services because we would rather you and your child be healthy than for you to be trying to do this on your own. And now we have a death that's unnecessary. We have a mom that's doing unorthodox things, and so on and so forth. So education and providing those services is what we do. Immunizations. We have a couple of different immunization programs. One is vaccines for children, and that affords any child from 0 all the way up to 18 and 364 days with vaccines. It is meant for under and uninsured, but we will vaccinate anyone. There are plenty of people that do or don't believe in vaccines because of whatever they've read. Vaccines work, so we provide them. We also have vaccines for adults. That is a rather new program that we have. It is federally, it's funded by a pot of money. I'm not sure which one. But it provides Tdap, Hep A, Hep B, and flu to adults that are not vaccinated or may need to get revaccinated or whatever the case may be. And so that program is something that is near and dear to our hearts because we want to make sure that the community is protected. Some other programs that we provide that aren't necessarily mandated but are related to women and children's health care is, of course, WIC, Women, Infants, and Children, which can provide formula and also some nutrient supplements to mothers that are expecting, as well as the children that they have or small children in the house. We're really excited about that program because in the last 7, 8, under 10 years, WIC has the ability to be used like at the farmer's market because we want you to have fresh fruits and vegetables. So that was like a really big win. Like that's exciting because, chips are great and you can make the kids stop crying, but that can't be your only source of nutrients for the child. We are very involved in conversations about food deserts. Just recently, there was a big to-do because the Publix on, what is that, Moncrief? It's at Gateway. That Publix closed. And so there's a food desert. There is essentially another food desert from the Winn-Dixie that's on State Street. I don't know if it changed to Harvey's, but the one that sits right there before you get up to go over to Matthews. There is not another grocery store unless you go all the way over to the Publix in Riverside. Or if you choose to go straight through and get on Beaver and go all the way down to Edgewood. There used to be a Premier on Beaver, like in McDuff, and that store may be back there. It kind of opens and closes. Did it close again? It's still there? Okay. But from downtown all the way to Edgewood, all the way to Riverside, there's plenty of convenience stores. There's plenty of chips and candy. There is the farmer's market. And so that's why it was a win for us to be able to get WIC into the farmer's market. No meat there. However, at least there's fruits and vegetables. We also have Healthy Start, which is a program that is nurse-driven. It is kind of a case management program, and what that does is work with at-risk mothers to ensure their baby has a healthy start to life, and so it follows that mother from the pregnancy all the way through baby's second year. It was just, a lot of times the mothers in that program may be very young and may not have good family support, and so it ensures that doctor's appointments are made and kept, that you understand the car seat. If you don't have a car, that you still have a car seat. So when you get in the car with someone, there's a car seat and the baby's protected. Let me show you how to use the car seat, because we cannot assume that everyone knows. When I first joined the health department, I learned the true definition of ignorance. Up until that point, you're ignorant. You act stupid. No. Ignorance, true ignorance, is a lack of knowledge. And so it is absolutely life-changing at the at the lack of knowledge that some of our residents have. If mom is 15, and so she's had a baby or she's pregnant, and grandma, mom's mom, is 30, and great-grandma is 45, 46, and so great-great-grandma is 60, like how often do persons that aren't in a low socioeconomic get to know not only their great-grandmother, but their great-great-grandmother? And the thing to know and recognize is that none of them, all of them, may live in the same apartment complex, which means none of them have been, if they live in Hollybrook Apartments, which is off of Beaver and King Street, they've not been to the beach. They've not been to the town center. They've not been to Mandarin. They live and operate within their 10 to 15 mile radius. And so they go to the ER, they know where that is. But one of the things that I also had to learn was to truly be careful with the education that we give. Ms. Tawanda said, don't go to bed just telling that doctor that I said. Listen to that doctor. But Dr. Ross said, don't go telling that doctor what we said. Listen to them. So you really, and once you develop those relationships, they're true and everlasting. And so you do have to be really cognizant of the education that you give, and ensure that you're providing something that when because they're still going to say, well, I go to West Jackson, Ms. Tawanda said no. That is a legit no, and the doctor is not going to call who is, yeah. So it's one of the joys, but also the sad things kind of about what we do. Education is what I love to do. I love to educate. I love to talk to our teens. As a baby nurse, I was like, oh my God, we get out condoms to anybody that walks in. Jesus, what are we doing? And so I had to get past that. And so now I'm like, a baby is the least of your worries. Okay, everybody has a baby. Your mom's mad now. That baby's gonna come here and everybody want to kiss and hug the baby. HIV, can't cure it. Herpes, can't cure all the H's. I can't do nothing with it. All I do is manage it. Gonorrhea and chlamydia, we can get you some meds. But if he's not getting treated, you're just going to have it again. So you got to take condoms. So I very quickly grew up as a nurse. And like, now I give education like a champ. You need to cut his knee back. I didn't bring any condoms, sorry. So those are some of the things that we do. And I want to take a little break to give you the chance to ask any questions thus far. Okay. So with our STD care, one of our more robust programs is HIV. And so there's a lot of money. HIV has a lot of money. It has a lot of resources. It has a lot of backing. Ryan White. That is actually the patient, Ryan White. There is an insurance for HIV patients that's named after him. There are lots of spokespersons for HIV. It is well known. People are educated, and there is a lot of money in that program. It's something that we provide, but we are still, as the health department, the community safety net. And so with that, we do partner with clinics. We do provide funding to clinics in the community. So AHF, I'm not sure what AHF stands for. It's at St. Vincent's. It's the HIV clinic for St. Vincent's. The Rainbow Clinic at UF Health initially was meant specifically for pediatrics because that is the only pediatric HIV clinic in our community here in Duval. is at Rainbow Clinic, but they will see the parents of the pediatrics, so they do see some adults. CAN Community Action Network, I know the name of that one. That is a new provider that is kind of a chain, if you will. And that's new to our area, but we also work with them very closely. HIV has dental services, mental health services, medication services. We are one of the few counties that does have an on-site pharmacy that deals in medications related specifically to HIV and a couple of other communicable diseases. But there's pharmacy, we have clinic, we have mental health, we have dental, and we have eligibility. The health department provides all of the eligibility, and I say that with caution because the grants change, and so I think that CAN can provide eligibility, but not the same level of eligibility that the health department can. So historically, we were the only provider for eligibility for HIV patients that are diagnosed. Now I think there is another provider in the community that helps us with that. We partner with the Jasmine Clinic, which is, I'm not going to even attempt to spell out what Jasmine stands for, but basically they service youth of the LGBTQ community. Sorry, I have to, make sure I get all the letters in there. But they service the youth of that community. So they see at-risk youth up to age, they just up their age from 23 to 26, which, we just kind of said, okay, because at some point, Jasmine is very much into ensuring that youth have care. And so you don't necessarily have to have ID, and you don't necessarily have to have all of the things that may be necessary if you were to walk in a regular brick and mortar clinic, which is okay because we want to make sure that those youth that are not supported have support. But at some point, we need you to join the rest of the world and understand that you need an ID, that when you come into a clinic, you still have to provide your government name. We will respect what you choose to go by, but we have to go by that. You need to know your social security number. You need to be able to get insurance and let us help you with that. And so we want to just make sure that those persons that were not supported as a teenager can function as an adult. And so we're a partner with Jasmine, and we have no qualms against it. We just want to make sure that they're helping us help them, help the youth transition into adulthood, and do that where they're not lost to care, because that's important. One of the other programs that we do is refugee services. So that is absolutely a hot topic with this administration that we have, whether or not to allow and not to allow and what to give. And so I just kind of scroll through my Twitter and I mum's the word because everybody's entitled to an opinion. Because I have been afforded the opportunity to work with refugees, I absolutely support refugees. I understand we provide mental health services for them because there are, just like there are people in our communities that are ignorant to knowledge, there are refugees that truly are seeking asylum away from their country. The services that we provide, the services that refugees are afforded is 8 months of Medicaid services. So, and that is basically enough for us to make sure you're in one piece and guide you into care, which means that you get a job, you support yourself, and you also get your insurance and understand how our medical care works here in the United States. So we work with community partners because we as the health department, DCF actually holds a contract here in Florida. And what's important to know is that a lot of people would think that Texas sees more refugees. And Texas does get a lot of undocumented persons. However, the state of Florida actually receives the most refugees in the country because of those refugees that were seeking asylum from Cuba and places like that. So we are their medical introduction into the United States. We provide immunizations because some people are coming from countries that don't provide immunizations. We ensure that the children don't have Giardia because if your country or the refugee camp that you've been in for anywhere from 2 to 20 years doesn't have good running water, diarrhea may be your normal. However, it's not our normal, and we absolutely don't want your 6-year-old going to our school system because everybody's going to have diarrhea because 6-year-olds are gross. And they don't wash their hands. They don't wash, and they share everything. Sure, I just came from the bathroom and I didn't wash good. Do you want some? Absolutely. At the lunch table or what have you. And so we do certain screenings and do just a basic physical assessment, and then also introduce them to that, and of course STD care if they need it. Unfortunately, there are people that leave their home country without any STDs, and by the time they come into the United States, they may have contracted one, even HIV. And so that's a difficult situation that we help them navigate through and ensure that they are linked to care. So questions, Ms. Okay. So, as the community safety net, we also are responsible for reportable diseases. And so there are a list of reportable diseases that are communicable. TB's included, STDs are included in those, hepatitis A. Oh goodness, the list, it's an 8 by 10, but the writing's real small. Real small. And so there's a slew of reported Shigella, Legionnaires. There's a slew of reportable diseases that we handle through our epidemiology or surveillance. With those reportable diseases, if there is an outbreak, we take over. And so in blue skies, meaning everything's great and there's no issues, if there's one case of hepatitis A, the epidemiology department does what they do. They make contact, they educate, and we vaccinate. However, nationwide, there has been an issue with hepatitis A. I think the state of Utah has been dealing with this. They have theirs under control, but it took them like 2 years. So it's been going on for a while, and it just recently made its way to Florida real good. So statewide, since January 1st of 2019, the state of Florida reported 3,400 cases of hepatitis A, with 63 of the 67 counties reporting. So here locally, we're a large county, and even though Duval has its borders for St. John's, Clay, Nassau, and Baker, they are considered our sister counties, and we are big brother to them. So there are a lot of services that we provide where certain positions are regional and actually oversee those counties as well. And because they're small, I want to say Baker's probably the smallest of those counties. You know, Baker County has one nurse, one health officer, one of this, one of that, and that nurse does everything that I mentioned. They do some epidemiology, they do surveillance, they do TB care, they do STD care, because Baker County is really very small. And a lot of people, and one thing to note is that a lot of people that live and work in Clay and Baker and Nassau, live in Clay and Baker and Nassau, work in Duval, okay? And so while their address may say one of those counties, we end up doing the contact investigation or just making sure that care is provided to them and their contacts. So hepatitis A, 3,400 cases statewide. Here locally, and that's since January 1st of 2019. Here locally, we started with 4 cases in the first quarter of 2019. And so that doesn't get me excited at all. Because there was an issue down in the I-4 corridor, like Hillsborough and Tampa and up through Orlando, Volusia County. Volusia not so much because they're a little closer to us, but Orange, Hillsborough, Pinellas, most of those cases came from that area, that 3,400. They reported the most. Some of them, one of the counties had like close to 2,000, some had 1,300. So when we had 4, I was like, so I don't need to be the incident commander, even though I'm over disease control. I got my plate full with disease control, so y'all take care of that. But I was dubbed as the PIO because obviously I like to talk. So I've been giving Hep A talks everywhere. So our 4 cases started to pick up around June. And we went to 8 and then 12 and then 20. And so we ended the year with 77 cases, which, and our DON went on maternity leave. And so then I got dubbed the incident commander. Thank you very much. And he was just born day before yesterday, 8 pounds, 7 ounces, Mr. Paxton. But because of that, I'm the incident commander and the PIO. So now I got to oversee Hep A. And I'm like, St. John's and ask them, why are you excited about 77 cases? Because, I mean, that's not a little bit, but that's not a lot when you think about our jail can house 3,500 of their full capacity. We have 4 large shelters, and then we have smaller shelters and programs around. We have several rehab centers, and notice I'm naming all the places where communicable living occurs, meaning you don't have a choice as to who you sleep next to. And you may or may not have good hand hygiene. So, I'm like, why are we excited about 77 cases? What's important to know is that we are a leading county for the number of cases that are being reported weekly. So the concern is that we could get to that 1,300 number just like that. And so where counties may report, we had 4 cases this week and 5 cases, and we were reporting anywhere from 5 to 10 cases a week, and that number just kept growing. So we went from about 20 in August to 77 by the end of December, like lickety split. And we just got through week 3, week 4, and we have 23 cases that we reported at the end of week 3, but we're actually up to 28 by now. And so today's Tuesday, and our weeks end on Friday. I give that report on Friday. So from Friday to today, 5 new cases. And so we're reporting them very, very rapidly. So in response to that, Incident Command is set up, and what that means is that in blue skies, our epidemiology department would take care of this, and nobody would care. Not literally, and I had to say that to them because they get their feelings hurt when I say stuff like that. But what I mean is that they would follow their policies and procedures and go about their day. Because we are in gray skies, meaning there is an outbreak, Incident Command is set up, and so EPI's no longer in charge, Incident Command is, and the state. So I get the pleasure of having our state surgeon general know me by first name, and I have a conference call with him every Friday to talk about the Hep A and our response here in Duval. So what we've done is we've been in our local jail. We're in our rehab centers. We are in all of our shelters. We are communicating with the local hospitals. We have an agreement with St. Vincent's thus far. UF Health and Mayo are getting on board. We have identified zip codes around the area where we have hot pockets of Hep A. And what's interesting to know is that of course, Hep A is spread in the stool or feces of those that are infected. It affects the liver. So diarrhea, upset stomach, nausea, vomiting, but also jaundice, clay-colored stool, very dark urine are also symptoms. The at-risk populations, men who have sex with men, those that abuse drugs, injected and non-injected, those with chronic liver disease, the homeless, and the incarcerated because of the possibility of no hand hygiene. And so with that, those at-risk population, each county was assigned a number to vaccinate. The Hep A vaccine was developed back in 1995, but the CDC did not add it to the children's immunization schedule until around 2005. And so while we do routinely give it to 1 and 2-year-olds, and we try to have 2-year-olds vaccinated try to have them fully vaccinated by the time they're 2, there are some that slip through the cracks, and most of us have not been vaccinated if we were not in school if we were out of school before 2005, graduated from high school, okay? A lot of secondary schools, colleges do require the hepatitis A, but again, that wouldn't have been until on or after 2005. So it's a 2-dose vaccine. So with that, each county was assigned a certain number to vaccinate according to that at-risk population. The thought process is that if you vaccinate 80% of your at-risk population, you can cut transmission and stop the spread. So remember I said we have 4 large shelters and all these rehab centers. Gateway is one of our biggest ones, River Region, just think of Lakeview Health, all these big rehab centers that we have, our jail can hold 3,500, and then it also includes our PIT count, which is our homeless count here in Duval. Our number at 80% is 17,800 and something crazy, almost 18,000 people. And so the issue is that those 77 cases that we had back in 2019, the majority of them were white male drug users. And so what we determined was that they're not seeking services. So they're not going to shelters. They are not necessarily going to rehab. They will go to the ER if there's an issue. So what we did was locate where those addresses were, compare those zip codes to JFRD's response to opioid drugs. I always get that one, opioid. Their drug responses. And we also compared it to JSO's drug arrest, not drug dealers, but drug users, and all of that matched up. So we have developed outreach in those zip codes. We finally got the city council on board because you don't want to create mass hysteria, but you got to educate the community. And we needed them not to plaster it all over the city, but to put up our flyers in places where those that may not seek services go. So in those zip codes that we recognized in the community centers, we've been to businesses and asked if we could hang it like there's a Family Dollar everywhere. So, I say it, but it's true. And there's always a Family Dollar in some of those communities where they have low socioeconomics. And so we partnered with businesses like that to ask if we can hang. JTA, we've partnered with them to get our message up in the buses, because if you are using all of your resources on drugs, you may or may not have kept up your car payment, and then the maintenance, so it no longer works, so you might be using the bus system. We've been going to local food pantries, and I had to educate, Dr. Rifkes was like, why is that? And I was like, well, Dr. Rifkes, normally you would think that the homeless go to the food pantry. However, if you are functioning and you are getting some income coming in, but you're a drug user, do you go to the grocery store or do you buy drugs? And then where are you going to feed? Because you are kind of functioning and you do have a family. So we got to get some food in the house, so you go to the food pantry. Okay, yeah, that makes sense. I was like, yes. So we're going to our local food pantries. Our efforts thus far have been slow. We were back at the beginning of January at about 2,000 vaccines administered in the community because we were specifically targeting a certain population. We have been able to increase that number in about 2 weeks' time to 3,700 is what I think I reported last week. We have been tasked with getting to half of that 17,000 by the end of February. So that's part of the reason why I was late tonight. Because we are making plans, talking to people, and getting our local hospitals on board hasn't been difficult, but I'm sure to get the message across that we as healthcare providers would need to be vaccinated because we work with this population, but please, let's not vaccinate all of the nurses in the ER, and then when we get in a drug response in the ER, we don't have a vaccine left for them. And so definitely it's going to help me get to that 8,000 if we just vaccinate all the staff, but that's not really how we want to go, because we hope that our staff is not going to the drug houses and living in a house where drugs are used and things of that nature. So we will be vaccinating until your employer may offer it to you, and that's okay. Tell them I said it's okay. But, go back to your homes, your work homes, and men who have sex with men, drug users, homeless, incarcerated. That's what we're looking to really vaccinate. And so you may see pods in our local ERs. UF Health is in our urban core. It historically has been our community hospital here in Jacksonville, so everybody still treats it that way, even though they tried to kind of change their image. They are still in 3202, and all around them is a lot of drug use, homelessness, all of that. The jail is within 3 miles of UF Health, and so with that, we have really been at them to let us get into that ER and provide some vaccinations. So that's happening. I'm super excited about that. We're having those conversations. And it is, I will continue to have a job so that we can keep you and your families protected. Yes. Okay, questions, comments?
Do you work at all with people like Warren Road or clinics like that?
So that's a good question. And I reached out, so Mayo Clinic, and I don't know that you guys know or if you work there, we lead the country in liver transplants and things like that through the Mayo Clinic. And so I work very closely with one of the infectious disease doctors. And so that clinic, all the hepatitis clinics, Mayo Clinic, they already routinely provide hepatitis A to any liver transplant or those that are on the recipient list. I want to say it applies to kidney transplants too, but I'm not really sure. But I know definitely for the liver transplants, Hep A is something, Hep A and Hep B is something that those patients are automatically vaccinated with. That doesn't mean that I'm still not calling them. Like, are you sure you're giving them? Can I send you some vaccines? Yeah.
Actually, for a lot of our outpatient floors that have that disability treatment. So
okay. Yeah, and so the reason that I'm calling them is because, yes, they do provide that treatment to all patients. Are they able to provide it to those that are unfunded as well? And so we can't. Here, I'll bring them to you. So you can remember I said VFC or VFA. Of course, to be a VFA provider, you gotta, deal with the state and, all these people gotta check it off. She gotta look at it. He gotta nod his head, So it takes a while. What we've developed is a MOU, Memorandum of Understanding, where, of course, I can get vaccines tomorrow. Like, I can put in an order of 1,000 vaccines and they'll be here, what's today, Tuesday? They'll be here no later than Thursday. So what we developed was an agreement where just say that you want to partner with us and I'll bring you the vaccines that you need. I just need you to keep good records and then we'll input them in before shots. And that's been one of the ways that when we've been able to overcome the hurdles of getting our vaccines out into the community. The jail is now a VFA provider, Lakeview Health. Those are the only two VFA providers that we have. We have MOUs with, the JFRD MOU is pending, it's before City Council right now. We have an MOU with St. Vincent's, and then I'm working on Mayo and UF Health as well. And so our shelters, we already had an agreement with them for TB screenings. I don't know if you guys were aware, but maybe 6 or 7 years ago, there was an outbreak of tuberculosis here in the county, in Duval. And so I was so tired of hearing about, don't do it like Duval. So it was, don't be like Duval, like it's been since 2011. It's 2020, like let it go, I don't want to hear it. And we're good. We are now the gold standard for how do you handle TB in the state. So we completely revamped our program, changed it around, and now everyone does it like us. And so with that, that's kind of why I was brought on for hepatitis A. Initially I was like, we got 4 cases, y'all need my plate is full. I got TB, refugee, STD, HIV. I'm good. And so, but now that, and then it took one person to say, well, y'all had that TB. Don't say it. Don't finish it. I'll help. What do you need? Because I don't want to hear it anymore. We are a great county, and stop saying don't do it like Duval. So that's kind of why I was brought on to Hep A. But we do, because of that TB outbreak, do shelter card screenings. So we have a program called Shelter Card Program. We do TB screenings for all those that are visiting our local shelters. We have agreements with Salzbacher, Salvation Army's coming. I gotta let the staff know. Salvation Army's coming tomorrow. I forgot. Yeah, I'm listening to that. Salzbacher, Trinity, City Rescue Mission, which are all right downtown, so we have agreements with all of them. So it was easy for us to get in there with hepatitis A. We were like, okay, we're gonna give y'all hepatitis A too, and they were like, okay. So getting into our shelters was rather easy, and we also, because we have that shelter card program, what the shelters do is you can stay overnight. If you present today, like when it was cold last week, it was so cold on Saturday, I was out and about, and all I had on was a t-shirt, and I was like, so anyway, sorry, I had a little touch of, that's commercial break. But, so, because we have that relationship, where was I going? We have a relationship with TB, we said we would do, okay, so our shelter card program, you can stay overnight, okay, so when you present, they will let you in. We have trained them to at least, are you coughing? Yes, you are. So you can stay, but I need you to sleep over there, okay? But then, by the next business day, they have to come to the health department, to our downtown location, which is right there near UF Health, and be screened and tested for tuberculosis. And we give them a card that says that they're clear and able to stay, or because they're in a shelter, that's the only group that we will hospitalize until we rule you out. Because I want to send you back to the shelter if you are coughing and able to spread tuberculosis, and we have on-site x-ray services here in Duval, so we get an x-ray right away, and if your x-rays abnormal, we will send you to the hospital and have you hospitalized until we can get sputum specimens and determine whether or not you are indeed active tuberculosis. It is one of the few diseases where you are guilty until proven innocent because it's airborne. So because we're already seeing a lot of our homeless population at Central Health Plaza, we just do hepatitis A vaccines in that clinic, specific to the homeless population. So that's one of the ways that we are able to protect them. And sometimes it's difficult because what are you giving me? We're not giving you anything, we're protecting you. And so we provide a lot of education, ensure that they are vaccinated. Because hepatitis A is one of those diseases where you don't have to know anything, kind of like TB. So if someone who is functioning homeless, living in their car, they still have a job, they're still working, but if they are in a grocery store and they don't have good enough hygiene, and they put the pen on the pad, and then you do the pen on the pad, and you're eating the barbecue chips, the kettle barbecue chips, Lay's, that you just bought me. You're eating those in the car. Did you wash your hands before? Soap and water. Hand sanitizer does not kill hepatitis A. It will help to stop transmission. It does not kill hepatitis A. Soap and water. Yes. So a lot of people are changing their routines. We did recently have a pediatric case of hepatitis A, which was sickening to my stomach because we've been giving routine vaccines since 2005, and he did get vaccines at the health department. What did we do wrong? It's very interesting. This 6-year-old has an older sibling that's 11 and a younger sibling that's 3. They are all contacts to the father. The family has experienced homelessness, but with the vaccination record alone, you can see stability and instability. You can see that the 11-year-old like got shots on time and then kind of fell off. You can see with the 6-year-old that definitely had to be at birth.